Hello, my name is Dr. Jamy Antione. I'd like to do just a few minutes is explain a little bit about peripheral neuropathy and chronic pain, help you understand more about your particular condition and the type of testing that we'll do to analyze you today. And we'll also be showing you just a little bit about our treatments as well. This will really help you understand more about what's possible in your situation. And one of our providers will also be looking over your information at this point, and that gives them a little time to go over your case history. So let's dive right in. I'll explain just a few things about nerve damage and what we'll be looking for today. So this is a very common picture. If you type in peripheral neuropathy on Google, this is typically what comes up right away. Peripheral neuropathy is also called peripheral neuritis, and very typically folks will have weakness, numbness, and pain from nerve damage, and usually this will be in the feet and sometimes in the hands as well, but definitely about 70% of folks have it in their feet, 20% in their hands, and about 10% in their hands and their feet. This is a really nice example, a very basic nerve chart showing healthy nerves versus bad nerves. And this of course shows 100% nerve function, and down here shows 0% nerve function. In our experience, people typically have to have 50% sensory damage or worse in order to start feeling the different symptoms of neuropathy or nerve damage. Pain and numbness are definitely common, as is swelling, pins and needles, burning, sharp electric type pain, tingling, walking problems, balance problems, and of course sleeping problems, very, very common as well. Causes of neuropathy, there's actually over 100 known causes of neuropathy, and this chart has the most common, which would be alcohol, autoimmune, diabetes is a really big one, exposure to poisons, which could be chemotherapy and medications, those are definitely common as well. Spine problems can cause nerve damage that go down to the feet, or if it's neck damage that can cause issues in the hands, of course. Vitamin deficiencies, and in a number of cases, no cause can be identified. That's called idiopathic neuropathy. This is a nice progression chart that helps you understand what's happening. Now, this particular chart shows diabetic peripheral neuropathy, but again, this could be really from anything, from medications or chemotherapy or spine damage as well. This would show healthy tissue in the foot as an example here, healthy nerves and healthy blood vessels, progressing all the way down to this example where you can see the nerve tissue and the blood vessels are very damaged. And again, this is where folks would feel the loss of sensation, they have pain and numbness and other issues as well. What nerves actually look like in real life is right here. Now, this is called an epidermal nerve fiber density test, and potentially is a test that we'll recommend for you based on your damage. What nerves look like in real life, right here, you can actually see the nerves that would allow you to feel different things, and when they're damaged, that's where you're going to get the symptoms that you're potentially experiencing. So with our test, or with our treatment I should say, what we're actually doing is getting those nerves to heal and to improve, and this is a really nice example. This is that epidermal nerve fiber density test before and after. Without going into a lot of detail, you can see the before. This particular gentleman had tissue samples in 3 spots of his leg. The high leg, he had highly reduced small nerve fiber density consistent with small fiber neuropathy, 6 fibers per millimeter. The middle leg, he had 4 fibers per millimeter, and the bottom is 2 fibers per millimeter. And that was all highly reduced small nerve fiber density consistent with small fiber neuropathy. The after, you can see very clearly, small nerve fiber density within normal range, within normal range, within normal range. So 6, 4, and 2 fibers per millimeter went to 17, 20, and 8. And you can actually see these are the new nerve fibers right there. So once we get those nerves working better and healing, that's where the symptoms can dramatically improve. We also recommend additional testing called an NCV or EMG test. You might have had this test potentially if you've been to a neurology office. These tests are very, very important and help us to detect nerve injury and dysfunction. And what those tests look like, this is an example of the hand, of course, but we would also be doing the spine or the leg. You can see very easily that they're pads and hooked up to a computer, sends an electrical signal that's very, very gentle and allows us to determine how those nerves are working. So based on your history and your symptoms, we'll potentially be doing that for you as well. Conditions that an NCV can diagnose are peripheral nerve damage, facial damage, nerve damage in the neck or the low back, all the way down to sciatic nerve damage and nerve damage in the leg or the foot, and also diabetic nerve damage. So those NCV and EMG tests are very, very important. The million-dollar question is, how do we treat things? So we do a lot of things here. This little video is only going to highlight a couple of our treatments, but we do a lot of things from IV nutrition and laser therapy and knee injections. We just do a lot of stuff. But in particular, our specific treatment program for neuropathy, I want to show you just a few quick things here. One of our technologies is called the RC Synexus NeoGen series. This is what it looks like right here. There's more than 30 published medical reports on this particular technology, covering neuropathy conditions, chemotherapy-induced peripheral neuropathy, foot drop, or long-term intractable pain conditions. FDA clinical indications for that particular technology, acute and chronic pain conditions, all sorts of things, and a big one too is neuromuscular re-education, getting those nerves and muscles to work better, and what's called re-education. This is what it looks like, and again, we can use this technology anywhere, but this shows a particular patient getting treatment in the legs. We also use what are called nutraceutical injections, which you can see right here. Now, don't let this get you nervous. The size of that needle is about the size of an acupuncture needle, so it's very, very thin. We are putting nutrition directly into the tissue that's damaged, and that really helps that tissue to heal faster. 99% of people handle these injections no problem. It's not painful or anything like that, and even if it is a little painful, we have a little spray that we can put on there to make it more comfortable. Most people, the vast majority, handle that just fine, and that's really important to get the nutrition into the tissue, and then this technology helps to really drive that nutrition deeper into the tissue. And that's how we're getting these nerves to really improve, is by basically feeding the nerves. We also have laser technology. At the end of my little video here, we're going to have you watch 2 additional videos. They're only a couple minutes long, but that's going to give you more information on the RST Synexus and also laser. We obviously don't have time to go into all the different treatments that we offer here, but we do want to give you a nice heads up as to what particular treatments we'd be using for peripheral neuropathy. We also test your balance. A lot of folks with peripheral neuropathy in the feet, because of course the nerves are in the feet, or the nerves in the feet I should say, help with balance. Balance can really become a problem when those nerves are damaged. And so if you do have some balance issues, we will be testing your balance today. And this machine gives us what's called a fall risk assessment, helps us to see how stable you are. The last thing that we want to chat about very quickly is we do not want to neglect your spine, meaning if you have a herniated disc or a bulging disc or something in the spine, that can also affect the nerves that go down to the feet. And so we don't want to spend all the time and the energy trying to get the nerves in the feet to improve if there's some involvement in your spine as well. So we'll be asking you some questions about your spine, and if you have x-rays and MRIs and those types of tests, we'd like to look at those as well. If you do have spine involvement, one of our technologies that we can use for spine problems is called spinal decompression therapy. And this is just a few seconds of this video that I'd like to show you. This technology is not traction therapy, this is decompression therapy. And what it's doing is taking the pressure from a bad disc off of the spinal cord or the nerves. And so again, this will show it to you. If you have a herniation putting pressure on the nerves, this technology will allow us to get those nerves to work better. So that's just an example if you had spine damage that we're able to treat that as well. So that's all that we'll do for this portion of the video. We have 2 other very quick videos coming up that will be done just in a few minutes, and then our provider will be in. And we'll talk about your history, and we'll talk about the different testing procedures that we recommend. And we'll go over all the game plan with you so you're really confident and you're knowledgeable about what we'll be doing today. And feel free to ask any questions of our provider as well. Thank you so much for watching. God bless you.